everyone, I'm Dr. Jerry Ann Preston, co-founder of ChiroCare Health and Wellness. If you tuned into our YouTube video last week, you'll see that Dr. Ramos went over our summer series of micronutrients. She talked about what they are, why they are important for our health and wellness, and how you can get a great deal this summer to make sure your key vitamins and minerals are at optimal levels. She also talked about vitamin A on our Instagram page, which if you are not following us, I encourage you to follow us at our handle ChiroCareND. So let's get started on today. Today I'm going to be talking about vitamin D. And much like vitamin A, vitamin D is a fat-soluble vitamin. So what does that mean? It means that your body only absorbs fat-soluble vitamins in the form of nutrition or supplementation when they are combined with dietary fats. That's a fun fact of the day for you. So why is vitamin D so important? That's really what we want to know, right? The main function of vitamin D is to aid in the absorption of calcium and phosphorus. It is considered the principal regulator of calcium homeostasis in the body, which is essential for skeletal development and bone mineralization. So although bone health is the highlight role of vitamin D actually plays a role in 36 other tissues and organs. Some of the key systems and cells it influences are our immune system, our endocrine system as a prohormone, gastrointestinal tract, cancer cells, cardiovascular system, and respiratory system. Because vitamin D is necessary in supporting so much of our anatomy and physiology, it is important that we have not just adequate levels, but optimal levels. Conventional medicine states that the reference range for vitamin D is between 20 to 40 nanograms per milliliter. But according to the Vitamin D Council, they actually consider that a deficiency in health and wellness. In naturopathic medicine and functional medicine, our ideal range is 50 to 80 nanograms per milliliter. This range has shown a correlation with disease prevention and optimal health. With vitamin D being so important, how can we acquire enough? The main sourcing of vitamin D is, of course, the sun. This is our sunshine vitamin. And although we all primarily have access to the outdoors, roughly 40% of Americans are actually deficient in vitamin D. So why is that? Here are a few reasons. Number one, not enough direct exposure to the sun. You need at least 15 to 20 minutes direct exposure of your skin to the sun in order for your body to produce the recommended daily allowance of vitamin D. Number two, malabsorption issues. The process of making active vitamin D, which is vitamin D3, depends on a multitude of steps within the liver, first through the skin, in the intestinal tract, and you need a healthy liver and intestinal tract to make this active vitamin D3. Number three, depleted nutrient resources. Our soil and our food resources are not as vibrant as they once were. Therefore, many of us are not getting enough from food alone. Number four, our lifestyle. A standard American diet and a sedentary lifestyle do not allow you to gain the nutrients in the form of vitamin D that your body needs. So while sunlight is your best option for vitamin D production, there are some foods that are typically more nutrient dense with vitamin D than others, and most of these are animal sources. These include fish such as salmon, sardines, cod liver oil, and mackerel, then eggs, lamb, and beef, human milk, and mushrooms. You might be wondering why cow's milk and cheese are not on our list, and while you can get vitamin D from those foods, they are higher inflammatory foods, and we do not find that they are best for overall health. You can, however, get vitamin D from nut milks such as organic almond milk or cashew milk. With vitamin D deficiency of 40% in the American population, most would benefit from vitamin D3 supplementation. The Food and Nutrition Board of the Institute of Medicine has recommended the upper limits of vitamin D levels to be, for infants 0 to 12 months, 1,000 IUs per day, children 1 to 18 years old, 2,000 IUs per day, and adults 3,000 IUs per day. With all that being said, we find the best way to determine whether or not you need supplementation, dietary assistance, or a recommendation to go outside more is to be tested, to get your vitamin D levels tested. With this summer's micronutrient package, we can test your vitamin D levels among 30 plus other vitamins and minerals. And then we can see whether you are optimal sufficient, or deficient in your vitamin D status. Along with this test, you will get a 60-minute initial consult with myself or Dr. Ramos and a 30-minute follow-up visit where we will go over your test results and provide a game plan for you to get your health on track. For more information about this and to get 20% off our summer micronutrient package, please visit us at chirocarehealth.com or call us at 734-259-4900. We hope that you learned something from this, and we encourage you to follow us on social media for our next micronutrient video, as well as continuing education on vitamin D. Thank you for joining us. I am Dr. Preston of ChiroCare.